nerve 1. It is the olfactory nerve. Its only function is to detect odors. The cranial nerve is an afferent nerve. It has no motor functions. It transmits chemical information from the nasal cavity to be processed by the brain. It plays a significant role in taste due to the limitations of taste buds, and its endings are replaced every 30 to 90 days. As you can see here, this is the olfactory bulb. It sits on the cribriform of the skull. The nerve endings protrude through the cribriform and lie within the nasal cavity. All right. The olfactory tract travels along here. The olfactory bulbs will sit here on the cribriform, and if you can see these indentations to represent holes, the cranial nerve endings will protrude through the cribriform and out into the nasal cavity. Odors travel through the nasal cavity and land on chemoreceptors of the olfactory nerve. Information travels through the cribriform, up the nerve to the olfactory bulb, then travels down the olfactory tract to various parts of the brain, including the olfactory cortex, involved with perception of the smell, the hippocampus, involved with memory of the smell, the amygdala, emotional response to the smell, and the reticular formation, visceral response to the smell. All right. 3 common dysfunctions with the cranial nerve are hyperosmia, an increased sense of smell, hypoosmia, a decreased sense of smell. This can be caused by something as simple as a cold, an increase in mucus in the nasal cavity, or possible obstructions, and anosmia, an inability to recognize odors, most commonly caused by head trauma, possibly caused by tumors or meningitis, and is known to be a congenital absence within albinos. All right, today, our patient, Becky, will be assisting me. When testing the cranial nerve 1, be sure to use non-irritating odors like vanilla or lemon extract or coffee. Have your patient use their index finger to cover one of their nostrils to isolate the other nostril. Then have your patient close their eyes and slowly approach them with the odor until they detect it.
Yes.
Okay, you may open your eyes. All right. Detecting the smell is all we're trying to do. Identifying the smell is a higher cortical function and is not required to have a positive on the test. You will repeat this process with the other nostril. Do not touch the patient, as they may give cues as to when the smell is present, and do not use irritating odors, as they may irritate the trigeminal nerve, giving a false positive.